Hey everyone, I'm Alan. This is Nick. We're both athletic trainers for the Andrews Institute. We're here today to talk to you about foam rolling techniques. The purpose of foam rolling is to increase range of motion when combined with stretching and to also increase or decrease soreness and tightness and to relieve pain. Foam rolling causes myofascial releases that help alleviate tensions or restrictions because of pain or that cause pain. Some precautions are underlying medical conditions such as diabetes, cancer, or arthritis. You need to make sure to consult a physician or healthcare provider if you're having these before doing these activities. You want to make sure you avoid bony prominences and open wounds and lesions that you may have or infections that you may have. Do each activity for 20 to 30 seconds and you want to make sure you focus on areas that may be of major discomfort because that's where you have the lesions at. Now Nick is going to help me demonstrate these specific techniques. First is the calf. So you're going to sit down on your butt with your hands beside you. You're going to put your leg on the foam roller and mainly focusing on between the knee and the ankle bone region. Then you're going to push up with your hands to bring your hips up off the ground, and then you're going to roll forward and backwards to alleviate any tensions that you may have. You're also going to turn side to side so you make sure to get all aspects of the muscle. Next, we're going to go into the hamstring foam rolling technique. You're still going to be seated. You're going to move the foam roller up so it's up under, it's just above your knee, and you're going to roll from there up to your hip region, and you're going to roll up and down slowly, and as well as in the calf, you're going to roll side to side to make sure you get all aspects of the hamstrings. Next, we're going to go to the piriformis and the glutes. You're going to sit on your butt on the top of the foam roller. You can also use a lacrosse ball as well, which is behind us. And there's also other sizes that you can use depending on the size of the patient. You're going to sit with your butt on the foam roller. You're going to bend your knees, cross one leg, which will be this leg, over this leg. You're going to focus on the left hip on this one, and you're going to roll up and down, controlling the tension with however much weight you shift to the area. And you roll back and forth, and then you switch to the alternate side. And you also switch to the alternate side on all of these activities. Next, we're going to focus on the IT band, which is on the side of your leg right here. So you're going to lay on your side with both legs beside you, and if you only need a little bit of weight on it, you do it like this. You can also take this leg, put it right here, and then you're going to, that puts a lot more tension on it, and you're going to roll up and down from here to here, and controlling how much tension you put on it by how much weight you roll onto it, and you'll roll up and down for 20 to 30 seconds. Next, the hip flexor. You're going to start by laying face down on the floor with your arms in a plank position, and you're going to place the foam roller right here in the crease of your hip, which is where your hip flexor is, and you're going to roll up and down to start with. You're going to have your right leg, in this case, on the side. If you need more weight, you can take the right foot and put it on the back of the other leg. Most people, it's not necessary. Then next, you're going to stop where you are, and then you're going to roll actually side to side. This causes a different level of tension onto the muscle to help alleviate any pain you may have in that area. More ways to hit the hip flexor. Next, we're going to go into the quad, so the patient's still going to be laying here. You're going to be in plank, or you can be in push-up position for doing this one. You're going to put your leg onto the foam roller. You're going to be working from your knee to your hip, and you're going to roll up and down to start with. Go as slow as you want, or you can go a little bit faster, but remember you're doing this for 20 to 30 seconds, so you got to be able to survive that long. You want to make sure when you go down each time, you switch to the roll to the right a little bit, and then you can also roll to the left and work on the inside and the outside of the quad. Next, we're going to go to the adductor and the groin area, which is going to be, you're laying the same way you do for the quads and hip flexors for the most part. And you're going to relax the inside of your groin thigh area right here. You're going to bring your left foot, in this case, up, and you're going to keep everything relaxed on the inside, and you're just going to slowly roll out, causing, and if you hit any area of major discomfort, you're supposed to slow down over that area to help press out what may be there. Next, we're going to work on the back. So we're going to flip to the back. Here, low back first. Upper back first. So in upper back, you want to make sure to lie with the foam roller in the center of the spine, and you're going to cross your arms, and then you take and you raise your shoulder blades up a little bit so they're not sticking into the foam roller, and then you're going to roll to the right side, rolling on the left side to roll out the muscles that are there, and then you switch and go to the right side. You do this very, very slow because of the way the muscles react to it. Then next we're going to do the lower back. So you're going to take the foam roller, you're going to cross your arms, you're going to sit in a seated position, put the foam roller underneath your back, and then you're going to slowly lean back, bring your hips up off the floor, and foam roll up and down. And you want to make sure you're focusing on the left side to start with, and then roll over and get on the right side after that. You want to make sure you avoid the spine because it's going to be a bony prominence that you're going to want to avoid because it causes a lot more pain than good. So thank you for your time. Foam roll and take care.